Hi, I'm Lou Northway, QI Clinical Lead here at RCVS Knowledge. Quality improvement to me is the combined efforts of professionals to strive to do their best for their patients and each other. This is the seeing, the doing, the measuring, the reflecting, the changing, and the reviewing. QI encompasses all areas of evidence-based practice and it encourages discussion, collaboration, and teamwork, the key of positive practice culture. Whilst it has a systematic approach, many of you will already be doing QI elements every single day without realising. Let us here at RCVS Knowledge take you on your QI journey. We guarantee it will transform how you view changes to processes, situations, and outcomes. You as a veterinary nurse in practice are perfectly positioned to practice and champion QI. You are in the thick of the day-to-day life of the practice, but also on the outside looking in. QI will help you monitor and measure how you and your team are doing, and it will improve job satisfaction through a more positive outlook. QI helps you navigate problems to help find solutions and rewards you in the long run with high quality patient care and team communication. I think it's very easy to assume that things are going fairly well in your practice because you only hear about the big disasters. But what about those small whoopsies, near misses, and undesirable outcomes like our post-operative wound infections? It's easy for these single events to be left on the sideline, but audit helps you collect data and see what might be happening. For example, if you work in a busy practice like mine, you might see one less than perfect wound per day, but another colleague might see another patient with a wound infection that actually might require antibiotics too. Individually, we may think that's not particularly significant as it was only one patient for me today. But if we measure how often all of our team members are seeing complications and you saw the cumulative results, you realise actually there's a lot of work to be done. After you've gathered your data, it's time to discuss things with your team. This is what's the whys and the things that might be happening. Then we look to evidence base and guidelines. That's looking at infection control, patient management, post-op advice, the list goes on and on. Once you start your quality improvement journey, I guarantee you'll want to look at more and more things. Start simple. Use the resources that are already available on the RCVS Knowledge website. Don't be intimidated because they are super simple and easy to follow. My first audit was looking at post-operative neutering outcomes via their National Audit for Small Animal Neutering page on the RCVS Knowledge website. Download their spreadsheet, collect the data, get your benchmarks and measure how you're doing against the rest of the UK. I guarantee you'll be really surprised all that you will learn and just how much you can improve. You'll also find tools for performing significant event audits, morbidity and mortality rounds, hot debriefs and so much more. Success to me is seeing the positive improvements in both team culture and patient outcomes. For example, sometimes we might get results which are undesirable. However, QI helps you navigate those times to find the positives when it's hard to imagine anything positive coming out of it. For me, when you start seeing improvements, which sometimes can take a little time, it is really rewarding. Also, when you see colleagues looking for QI tools such as significant event audits or a hot debrief to support and guide them, you know QI is well embedded within your team and it will become their friend day to day. As Maya Angelou once said, when you know better, do better. And that is what QI is all about, the combined ongoing efforts of everyone to do better.